on after we close, maybe, and
Yeah,
shut
yeah.
down the
So
thing.
we're live, and greetings and salutations to everybody this August 27th, and sort of getting right into the mix of OEP, AEP, the fun season, the 4 month sprint. I'm your genial host, Jeff Beglin, and Brad Petrella is also on the call. We're both
Hello.
business development managers for Cornerstone, and we are glad to introduce Jared Wassley from Oscar. He's going to do the plan preview for 2025, and just a little housekeeping. I'm going to roll through a couple of slides here. You know the drill. You'll put your questions in the question box, and we're going to monitor these throughout the presentation. So don't be shy, and we'll get questions through the presentation and at the end of the presentation. So don't be shy. I'll jump in if need be. And we're the dynamic duo of the individual market. We test marketed the idea like maybe two bald guys in blazers selling insurance, but well, we've tabled that. So I'm Jeff, he's Brad, and there's our contact information. And be sure
Thanks.
to. Brad, do you have a comment?
I'm more bald than you, but
I don't
that's
know.
okay.
I don't know. I think I got you beat.
Okay.
I think
Well, maybe.
I think we got you
Uh,
beat. Um,
Nonetheless.
we're on social media, and the Monday Minute is a fantastic resource. So much stuff coming down the pipeline. Check it out. Industry updates. Most important thing is call us if you need us. Absolutely. And let's toss it to Jared. And I'm going to, through the magic of, I hit the wrong button. That's brilliant. Okay, let's do this. Okay, there we go. Okay. All right, through the magic of technology, we are going to toss it to Jared Wesley from Oscar.
Hey everyone, thanks Jeff, thanks Brad for having me. Happy to attend
You
this.
bet.
We of course do this every year with you folks, and try to give you sort of an early insight. We haven't finalized all our intricacies for next year. We'll have our sort of Oscar official webinar invites coming out in the coming weeks. We'll probably host that sometime in October. We wanted to give you sort of an inside scoop on what we're expecting. Just some small county area expansion and kind of reminders from last year as well. So again, my name is Jared Wastley. I'm a sales lead here at Oscar. I cover what we kind of describe as our mid-Atlantic market. That includes our mid-Atlantic states like North Carolina, Virginia, Pennsylvania, but also Ohio and Georgia as well. So happy to be here. Been covering Ohio probably for the last 4 years or so, and with Oscar for a total of just over 6 years, which is actually a veteran by Oscar standards. So happy to be here. We continue to utilize the same kind of approach with everything that we do from a member-centric point of view. We combine technology. We actually build our own in-house tech, our own app, virtual PCPs in some states, virtual telemedicine. We've always been at the forefront of that. Frankly, pre-COVID was always a large part of our drive for affordability for our members. But we do believe that building out your own technology, an easier workflow for the member, helps them realize cost savings and, frankly, much higher satisfaction scores. We have incredibly high NPS or net profit score, promoter score than the average health insurance carrier, which tends to be incredibly low. And that's because we directly interact when we want to interact with our membership. We've had some really fantastic milestones. We actually founded in 2012. 2014 was our first market. It was New York. If you recall, we had the Cleveland Clinic launch in late 2018 that we announced that. That's been really successful for us. The year after that, we expanded into Columbus. If you recall, last year we expanded into Cincinnati as well. So Ohio has always kind of been a pretty important state for us and one of our major states. This is actually an outdated slide. This is prior to open enrollment. We actually now have 1.6 million members. We announced that about a month ago in our most recent quarterly earnings. So had a really strong open enrollment growth, getting to about 1.3 million. And of course, as you can imagine, a lot of SEP growth as well. That's helped us hit 1.6. You'll see that number reflected correctly once we start to roll out our official webinars next month. We're still in 18 states. We aren't going to be doing any state-based expansion, so there won't be any new states for next year. But we do have a number of county expansions, and we'll go through the county expansions for Ohio as well for next year. And this all kind of comes down, what I mentioned early on, to ease of use. So building your own tools, you're not having to utilize a third party to build a workflow for you. We can drive member engagement. We want members to create an online portal, download the app, utilize, whether it's even, prescription renewal or whatever the case might be through the app. This engagement does drive lower out-of-pocket costs from day one, and that's something that we've always kind of utilized. You of course, have a very robust network to utilize, but we feel like technology is sort of an add-on to drive affordability, not necessarily the only conduit to which you can use care. From our 2024 product portfolio, it remains very much the same as next year. As you remember, there were plans that were deprecated for last year. So kind of the hard work has sort of been done, so to speak. We removed certain plans that had very low membership, something like even the HSA just in Columbus was removed. We kept the HSA in Cleveland, of course, and kind of helped us to drive members to the plans that frankly made the most sense, had the best product market fit. And that's obviously, down to the CMS ruling of what we had to do as a carrier, and every other carrier did as well. But we've actually seen really great responses from the market. It's easier to understand your plan. And of course, for brokers, much easier to, learn about the 13 or 14 plans that Oscar holds versus the 25 plans or whatever the case was. So we think that this is kind of a win from the consumer perspective, from brokers as well. And then us as carriers, we kind of forced as well to be a little bit more creative with, some of these non-standard options that are around. So for example, the PCP Saver Plus, very popular bronze plan, particularly in Cleveland. Great for kind of day-to-day, seeing your PCP. You're not really going to your specialist that frequently. And then, of course, seeing something like a Silver Simple PCP Saver, the most popular silver option by far, and kind of a one-size-fits-most for anyone who receives a subsidy. So there's definitely use cases that we've seen members switch to plans that make a lot more sense for them. And again, now as a broker, you really are equipped to make the best decision, since there's a clear benefit between one plan and the other. Our partners for next year will remain the same. We actually only use CVS for their sort of, not so much as a PBM, so they don't manage our formulary, but they do manage the network. So that's Target, Walmart pharmacies, CVS, thousands of mom and pops throughout Ohio. But we actually built out our own formulary as well, which gives us a little bit more flexibility. We use Optum's mental health benefits network. We have pediatric vision through Davis. And then I think that the larger news is having Quest and LabCorp as an option for in-network lab partners, very much the two largest lab partners across the country. From a market and network highlight, I just want to go through a couple additions. So if you recall, this is the existing service area map with the Cleveland Clinic plus Oscar. This is actually a joint venture with the Cleveland Clinic. So, we can expand as fast as Cleveland can, essentially. And so we've kind of been stuck sort of in this sort of sizing for some time. As you can imagine, it's a very, very robust network. No matter where members live in the service area, they can access any of the facilities or doctors with Cleveland Clinic. And then in Columbus, if you recall, we moved back to this kind of regular single network all around Mount Carmel, which gives us really good breadth. And we added an additional county last year as well. And this has kind of really become the sort of cornerstone, excuse the pun, of our marketing efforts and distribution efforts in Ohio. Columbus is actually a larger market now for us than Cleveland, which is quite interesting given a slightly smaller region itself, but it's become really important for us from a carrier perspective. And if you recall last year, as I mentioned, we added 5 counties. So most importantly, the 4 main counties around Cincinnati were kind of the big expansion flow. We added Hocking County um, in sort of the more rural southeast of Columbus. And so for next year, it's not shown on this map, but we will show it next month. But we will have 3 additional counties around Cleveland. So we'll have Holmes County, Carroll, and Harrison. You can kind of point them out. They're all around the Tuscarawas region. And then in Columbus, we are actually adding 5 counties. So we'll have Clinton. Well, actually, it's sort of 5 in Columbus, 1 technically in Cincinnati. So they'll actually sort of join one another. So that'll be Clinton, Fayette, Pickaway, Morrow County, Vinton, and Morgan County. So a lot of sort of smaller, more regional, or should I say, rural expansion counties for us next year, but kind of a natural flow with the partners that we have. So always good to kind of be expanding. We're looking more and more like a statewide carrier, at least in the 3 largest metros in the state, and of course looking for additional expansion going into 26. But for 25, that's kind of how our expansion efforts will look. From a pricing perspective, just kind of early rates from what we're seeing, Cleveland will stay very much the same. We, of course, have a premium system and network there. So that will kind of be the sort of status quo, but we will have access into these more rural counties for folks who need to access Cleveland Clinic. Columbus, we look very competitive in both bronze and silver, so we're expecting a lot of growth and expansion, of course, including those counties, but also growing with or faster than market rate. And then Cincinnati for now, looks like we'll have kind of similar pricing from last year, maybe not as competitive perhaps, but we'll still have a very, very competitive network and product market fit there overall. Less growth options than last year, but we've had really good retention and growth from that book last year. So I want to thank everyone who wrote business for us in Cincinnati last year too. Kind of on the plan and benefit spotlight, just wanted to highlight a few things. I kind of touched on this a little bit earlier, but just always worth going through kind of the most popular options. So in Columbus and Cincinnati, the Bronze Elite PCP Saver Plus continues to be a very, very popular plan. Of course, it's bronze. It's not as important or large a scale, you could say, as silver, but we see a lot of folks picking this Bronze Elite plan. So maybe they're getting a subsidy, but they don't really get a lot from the cost share reductions, the CSR plans, and they have really no upfront medical costs. They might be a younger family, younger couple. So this is essentially a copay plan that's at bronze pricing. So you have very low upfront costs with kind of PCPs being fairly affordable. There's an urgent care copay, and these members typically aren't on any tier 1 or higher drugs. So they might take a generic here and there, but there's nothing chronic that they're using. And it's a great kind of pure health insurance plan that we continue to see being very, very popular in the 2 metros there. In Northeast Ohio, we see Bronze Classic PCP Saver being also very, very popular too. Again, largely for folks who don't have very urgent or kind of frequent needs for a specialist, but again, they want access to the Cleveland Clinic should something happen. But then if they get, a cold or the flu, they can go to the PCP for $30, urgent care for $100 should they need to do that, and they want to stay in network with the Cleveland Clinic. So we've seen this being a very, very popular option for folks wanting to access that network. And then the Silver Simple PCP Saver, which is available throughout the state. That's kind of what I mentioned earlier as being the sort of one size fits most. So it's great for highly subsidized on-exchange clients. So these are folks who are at 150, 200% of the federal poverty level. They are getting that CSR benefit from these plans. So then the PCP, the urgent care, those prices go down with income. So this is kind of at full price, the pricing that you see here. So it can be as low as $5 or $10 to utilize those specialists. And again, very affordable RX benefits. Tier 1 are very, very affordable when we launched that $3 drug list a few years ago. And then there's also a copay on labs with even tiering options as well. So this kind of is by far the most popular silver option in the state, and that's because it's kind of the one-size-fits-most approach, as I mentioned. And as I mentioned, this also is available with the CSR option. So again, notice how the pricing goes down significantly. This is at 200. As you can imagine, at 180, 150, that goes down even more. Wanted to touch through on app and account creation. This is actually something we've been sort of testing. We always speak about it in all our webinars, but we actually did this sort of testing through the year. And what we noticed is that brokers who had members that had an account were stickier for the carrier, but also for the broker as well. And that makes sense, right? They're getting more out of their plan. They can pay their premium on there if they need to. They can quickly search for in-network care. They aren't necessarily coming to the broker for kind of those mundane day-to-day tasks, but ultimately they are happy with the service. They will be happier with the product that you've given them. So we really like this, especially the access cost estimator, which is available for certain things. The reviewing and renewing active prescriptions also been really, really well taken care of as well. Just basically being able to reset and renew prescriptions as fast as you would ordering an Uber, so to speak. So very, very easy to utilize, and something that is, again, a day one benefit for members as soon as they enroll. And even if someone isn't very sort of phone savvy, they have very similar functionality on the online account as well. So we always ask brokers, please make sure that your members are creating an account. It genuinely drives better usage and use care. They can message their care team if they have non-urgent requests. Again, searching for doctors in network, and even finding virtual urgent care online too. And then on the pharmacy, kind of just finalizing that, just wanted to reiterate what we'll do for next year as well. I mentioned we just utilize CVS as the pharmacy network, but we actually have our own formulary that we built out, and that's so that we could design our tier 1A list. So we call it our $3 drug list. And essentially we did this by looking through member claims and seeing, what could we do? How large would this tiering need to be? And we essentially identified that over 80% of our members had either been prescribed or could switch to one of these drugs. It's pretty comprehensive for a low tier. It's almost 100 drugs, nearly 300 variations. There's one or two branded insulins in there. There's even affordable antibiotics in there that are also brand names. So it's definitely been taken with a lot of care to create and formulate this formulary. Again, this is a $3 copay. It's not subject to deductible on most plans except for catastrophic, of course, or HSA plans. And so day one, members have this $3 drug list. So really, really strong benefit, easy to explain to members as well, and easy to understand if this drug is on there. So always recommend, seeing if members are eligible for this list, going through the drugs with them as you enroll them, of course. And, there is good breadth here as well. And then just want to speak through kind of the support on our side, so how things are structured. Of course, I am the sales lead for kind of new business, for any escalated issues, but kind of your day-to-day would still be the broker support team. So they're based in our hub in Tempe, Arizona. They work through certain pods, so we have specific pods for specific regions, and they're available 8 a.m. to 8 p.m. Eastern. So utilize that 855 number if it's anything urgent or you just need a quick answer. And for, adjusting, asking for commissions related escalations or anything like that they have to look through, you can utilize that brokers@hioscar.com email address there too. And then finally, this is actually going to be updated slightly as well. So /brokers, this should be saved for any writing broker. So this is where you'll firstly, you can access the broker portal. Everyone should be appointed with Oscar. You'll get invites to all the webinars. You also need to be appointed before you write any business with us. But you can also search plan documents, SBCs. The formulary search is available through there as well. So important to kind of keep this lined up as an option for you, and plan grids as well, also available there too. So that's all that I had prepared for this morning. Wanted to keep it fairly short and punchy, just give kind of the highlights. Thank you so much for Cornerstone for hosting this and hosting us, and happy to answer any questions that might come our way.
Great, thank you so much, Jared. By all means, put your questions in the question box,
Yeah.
And
And then Jared, just so that those brokers who are on the call with us, when do you expect to have your virtual product presentations? I thought we were going to have a little bit more 2025 ready, other than what you shared about the expansion, which expansion's always good. We like that. But do you have any dates yet that you can share with those on the call
Yeah,
so they
so
can
that's kind
block
of
off their
the
schedule?
main news next year really is that county area expansion. There isn't going to be a lot for um, plan specifics, but we will have a better idea of pricing. We're still in secondary filing right now. And
Okay.
then the actual Ohio, presentation itself live will be October 23rd. We haven't sent out those invites just yet, but they'll probably
Okay.
be going out in the next 2 to 3 weeks or so.
Okay. I wanted to write it down so I could block it off on my schedule, and maybe they want to too. So everybody, October 23rd. I'm guessing that's probably in the morning, Jared, usually.
Yes, 11
Okay.
is usually when we'll probably have almost
Okay.
all of our webinars at 11. We seem to prefer that.
Okay. Yeah, it gives everybody a time to get it together. Great. But so, are there any special benefits, sort of like value add benefits that's being kicked around, maybe that are on the docket to potentially be added? I know it's hard to make promises early.
Yeah, no, for sure. So nothing just yet in terms of kind of like benefit specifics. We are looking at a few possible member benefits and kind of rewards programs. That's kind of in its final outlay right now. So that's kind of why we're waiting on a couple, pieces to fall in place to confirm that. So it won't be any, plan specifics, but there definitely are some member rewards items which you're looking to amend or add.
Okay, got it, got it. Well, everybody will be. There's this funny uh, Benny Hill line, waiting with bated breath. So we'll all wait, and anybody who's as old as Jeff and I knows who Benny Hill is. So anyway, there is a good question from Todd, and maybe you could, Todd Tucker, maybe you could share it, Jared. Is how is Oscar's penetration down in the Hamilton, Butler County area around Cincinnati? Do you have any like stats that you can quote off the top of your head?
Penetration from a market share perspective
Yeah,
or from
yeah,
net.
market share. Yeah, market share is probably the what we're looking for.
So what I know from, I won't go into county specifics. I don't even know if we look at that overall.
Or
We'll look at
region.
rate area.
Yeah.
But I think it's probably around, it's got to be close to 15, 20%, give or take.
Okay, that's very
Yeah.
good.
So
Yeah,
and frankly, that actually kind of matches Columbus. It matches similar to Cleveland as well. Cincinnati grew really well. We have great network partnership there as well. We had good pricing, of course, that helps.
yeah.
Um, so yeah, we'll see how it goes next year. We won't be lowest cost bronze or silver necessarily in Cincinnati, but we aren't expecting any kind of crazy adjustments in membership there.
Okay, good. And claim, I mean, I don't know that you get shared that information, but obviously price is driven by claims. Claims so far this year, is there good claim experience, high claim experience? Because that obviously drives rates, right?
Yeah,
For the next
definitely.
year.
Yeah, premiums are directly correlated to unit costs, right?
Yeah,
Yeah, no concerns there. Actually, I'm seeing that we possibly might be lowest cost bronze in Cincinnati.
good.
Silver's kind of up in the air a little bit. But
Yeah,
yeah, there's been, you'll see pretty low rate increases. These are public, right? So,
yeah,
rate increases in Cincinnati, for example, I think we only requested like a 2 or 3% rise there. So very well within expectations, probably a little bit better overall, and that's actually lower than other increases in other parts of the state, actually. So
yeah.
good question.
Uh,
Yeah.
yeah, well, and I'm sure as I look at all the names on the call, we have a whole lot of Northeast Ohio brokers. Um, do you think we will see something less than the typical 8-9% increase that we got if you were to postulate a little bit?
Probably not, honestly. It is an expensive
Right.
network. frankly, it is premium, right? And we're, we obviously have a lot of, it's a 50-50 joint venture, right? So it's equal parts, both carrier and system. We don't add on any increases that aren't necessary based on, population health and, market risk and all those kinds of things as well. So
Got it.
obviously, I would love to have, lowest cost or, lower
Of
cost, should I
course.
say, but at this moment, we remain the premium system. And Cleveland's really an outlier. That's not really our general take for anywhere else. Generally, we're much closer to what you would see in Cincinnati or Columbus, right? Second, maybe lowest cost, just depends. We don't really kind of try to outprice everyone. That hasn't worked well for other carriers. We won't do the same. So
Yeah.
Cleveland is unique in that, but it's a direct correlation between the market breadth and the risk pool of that area too.
Got it. Very good. Understandable. I think if you were to
I got
say,
a few. Yeah, I got a couple
just hang,
comments. Okay.
so in terms of markets between sort of the three major markets, well, or Cincinnati will be, well, Cincinnati's there, but between Cleveland, Columbus, and Cincinnati, which is the largest? I have to believe it's Cleveland because of that Cleveland Clinic relationship.
It's actually Columbus. Yeah.
Really, that's
So
interesting, gang, on the phone. So Mount Carmel is a meaningful provider, as many of
Oh yeah.
those of you
Oh yeah.
in Columbus know. So
And they're actually also
high
expanding. They
quality.
have a new hospital that's opening outside of Dublin. I believe it's in
Hmm.
Q1 or Q2 of next year. So there's even
Hmm.
better breadth out there. Um, you know, we're actually at a point in Columbus where we'll probably have to even look at adding additional aspects here and there to support the larger membership. One thing that I'll always kind of talk through on Columbus is that there's still a lot of opportunity there for brokers. It's a comparatively small pool of local or even Ohio-based brokers there. So I would always ask, whether your concentration is Cleveland. I would heavily look at Central Ohio, even Southwest Ohio, as possibly spending marketing dollars out there, spending some effort to get some additional breadth there overall. It's a much smaller broker pool than you would think given the market size.
Right. Yeah, we see that as well.
And we're a huge advocate of local brokers. We would love to push our business through local brokers. We think they make, the difference in many ways, obviously. And we would love to be able to support more locally based brokers there. So if you're looking to expand there, or you don't know that much about the market dynamics, feel free to reach out to Jeff or Brad or even me directly if you want to learn more.
Great. What other
Great.
questions did you
Oh,
have,
I've
Jeff,
got a
or
couple.
ideas?
Yeah. So it was brought to my attention that you won't be partnering with Health Sherpa for the upcoming year. And I'm seeing this in other parts of the industry as well. There's some issues with Health Sherpa and carrier partnering and stuff like that. So can you describe, how someone's going to be able to enroll? What other options do they have besides Health Sherpa?
Yeah, no, that's a great question. Actually, thank you for bringing that up. I should have mentioned it. So, yes, we do not have a partnership with Health Sherpa this coming open enrollment. We put out an email to every single appointed broker in Oscar's Salesforce hierarchy. So I think it went out to 40,000 odd folks. But essentially, the partnership broke down. They asked for something that was very unreasonable, and that would not have allowed us to compensate brokers correctly. It would have had a severe impact on us financially, and even the rate filings and premiums to drive affordability. It would have made that, frankly, impossible. So we're looking at alternates. So there's a few different options. So obviously it's an FFM state, Ohio that is. Many brokers I'm sure also sell in other states too, but continue to write through the exchange. I know that the quoting capabilities are quite nice on Sherpa. We will actually be on the window shopping portion of Health Sherpa, my understanding is that you
Right.
can't remove carriers from that. But if you went to enroll someone on Oscar, you would do that weird sort of double redirect going through healthcare.gov in order to enroll. So not the greatest experience, but you can still do it. It is an alternative. We're working with, there's so many different EDE partners. I will mention two that I do know that folks can work with. They do have agency arms to their business, so I will just go out and say that. But so does Sherpa. So there isn't anyone who has an EDE platform that only does EDE. It doesn't exist. But I would advise members to look at INSX Cloud or my MFG. Those are kind of the two options that, frankly, are most close or the most closely mimicked to Sherpa. And they aren't blocked by CMS, which some of the other EDE platforms had. So there's actually quite a bit of sort of disruption in the EDE space. And yeah, those are really the only two alternates that I can accurately say have a similar experience. And again, full disclosure, they have an agency arm, so does Sherpa. So everyone has an EDA platform has some form of agency arm as well. It's just kind of, I think how they monetize and keep it free essentially. But my understanding as well is you'll never be forced into working under the agency or anything like that. You can utilize it purely as a platform. So we'll have a little bit more guidance on that. We're working with both those systems to see a little bit more. We kind of want them to be, carrier and GA and agency agnostic, to be a real competitor with Sherpa. But those are definitely the two best options at the moment.
Got it.
Yeah,
And
and
doesn't INSX Cloud, isn't it a fee-based access portal? Because
No,
I thought they shut down their free.
they used to, and in the last 6 months, they are now free.
Okay.
okay.
And I don't know
Well,
about my
yeah.
MFG.
My
And
MFG is based of a different kind of GA, but they have a separate arm that has the ED capabilities. I
Okay.
would imagine a higher INSX is probably I wouldn't be surprised if almost every broker had used it or had an account with them already. But yes, they launched free, I want to say in the last 6 to 12 months. So it's a fairly recent change in order to, frankly, directly compete with Sherpa.
Mm-hmm.
yeah, and
Got it.
so, as a GA, we've got a great relationship with Sherpa over the years. It's a little awkward, and I certainly understand your perspective and Oscar's situation. I will say that your website, your enrollment site is great.
Yes.
And I want to emphasize it's not just on exchange, it's off exchange as well. So, my mode of operation is going to be, quote it on Sherpa if you need to, but go to Oscar, their website to enroll. And I mean, it's going to let me pivot to another topic, and that's ICRA. ICRA, uh, tell us about Oscar's, um, take on ICRA and how maybe our clients can use your off-exchange portal for that.
For sure, yeah. No, thanks for mentioning it. So we are very bullish at Oscar around ICRA. If you've listened to any of our last 3 or 4 earnings call, I think we mentioned that in every single call. Our CEO believes that that is the future of the ACA and the individual market. Is that small and large group employers are going to naturally start feeding into the individual space. It's just a moment of time, and ICRA is the first kind of avenue to do so. We actually have our own internal ICRA team. I know the gentlemen on the call now have been working with my counterpart, Andy Muller. He's kind of the go-to guy for Ohio, Oscar ICRA. And that's kind of our commitment to it, right? We have an additional inside team that's just focused on growth with ICRA partners, helping brokers write ICRA policies. So, this is kind of similar to selling a small group plan, right? You have to be very involved with the group. You have to be involved with, the admin sources and all that kind of thing. So we'll have a little bit more on that down the line. But yeah, we are very heavily involved in it. And kind of just as a reminder, Ohio is a serious hotspot for ICRA, and that's because in most counties, the premiums, bronze and silver, are lower on the ACA on and off exchange than they are for the equivalent small group product. And so there's a lot of interest in growth, particular for the state. And that also exists other places as well. New Jersey, Georgia, some parts of Tennessee, you see similar kind of aspects there as well. But it's also a large group play as well, right? It's it's guaranteed issue. It's age rated. If a large group employer has a huge amount of claims that come in, they might look to save some money for premiums. And we're at a point now in the ACA where you're not dealing with these hyper narrow networks where you have 50 providers that you can go in. These are established markets. We've been in Ohio for 6-7 years. Obviously, even other carriers have been here for longer, but even the provider networks themselves, they really are about as robust as small group networks are.
Yeah.
And a lot of them have kind of pivoted from small group networks. So there's really no kind of user experience that is changed from an actual member or from an employee in that case. So it's really about educating, businesses. Can they save money from it? Can these employees, also a lot of them might be first-time consumers of healthcare. Right now, you go to a job. Hey, here's your 5 plan options. Pick the one you want. Now they have this huge choice of 5, 6 different carriers and the plan, and that's kind of the only kind of slowdown we see in ICRA. But we see this as a win-win for the consumerization of health insurance, and then also a cost saving for the business too.
Right. And I think for those of you who were in Cleveland in April, you got to meet Andy Mueller, who visited us while Jared was on a family leave. And mark it on your calendars. Andy is going to be back. And I don't know, Jared, if you want the invite, because I just typed it up this morning before this call, but October 19th, if you want on the invite as well, I'll send you the invite too. But Andy is going to be doing an Oscar ICRA presentation for us on October 19th, usual time, 9:30 to 10:30. And as many of you know, we have here at Cornerstone Broker Services been pitching ICRA a lot more this year because we see the trend. Once it took a little earlier in the year, late last year, it took some convincing because we also sell a heck of a lot of group insurance. And the group side of our team is a little hesitant because it now goes from their side of the house to our side of the house. And like you all know, nobody likes to lose commission. So they're worried about it. But we're trying to get them integrated where if it's their account and they move, they get it. So it's been talked about a lot. We did an ICRA training. If you're interested to learn more just about ICRA as a topic, if you go out to the Cornerstone website, crnstone.com, in the resource center, you're going to see a presentation that our teammate Lael Reitler did on ICRA. It was probably our most heavily attended um, training that we've done.
Over
Where
100.
yeah, all that registered, 90% of them showed up. Unlike these, where about 50 to 60 show up. So, but a lot of you watch it on demand. So, ICRA's a big deal. Everybody's talking about it. If you're a NABIT member, it's been talked about a couple of times already with trainings. There's a couple more that are being talked about. So, this is a great opportunity. You all are in the local markets and you know the guy who does your landscaping and you know the guy who fixes your car. Those are the small businesses that are ripe for ICRA. Just because they need insurance for their own family, and group health insurance is expensive because it's written on them. It's a policy of one and their risk, not a larger pool. So great opportunity for you to add a new segment, but a segment that's adjacent to one that you're already in with the ACA. So, and we can help with that as
Couple,
well. We have the systems.
if I might jump in here, just a couple
Yeah.
questions. Uh, Aziz asked if someone buys an Oscar on exchange without subsidy, Will that Oscar plan be the same premium off exchange? That's a good question.
Yeah, that is a
On and
good
off.
question. So on and off exchange plans are exactly the same price, regardless of carrier, with the exception of if there is an off-X only silver plan. So, for example, we have an off-X only silver plan in some states. Essentially, not to get into it too much, but that doesn't have the silver loading that you would get on an on-exchange plan. And that plan alone, just that one off-X only silver plan, um, does differ in price. Depends on the state. It can be 3, it can be 8% difference, but just that one plan, it can be lower cost on the silver side.
Gotcha.
But in general,
Okay.
if we're talking ICRA here, I'm not sure if that's what the question is. It's the same on and off with the exception of that one plan.
Maybe that's why it was brought up. And I noticed no HSA. Is there a possibility maybe, in 26 we'll see the HSA back or?
Yeah, so HSA is still available in Cleveland, so I don't want
Oh,
anyone
I
to
see.
be
Okay.
afraid. Yes. So
Okay.
we removed HSAs in areas where they weren't heavily utilized. Cleveland,
I
it
see.
is heavily utilized,
Hmm.
but in other states, especially with the enhanced subsidies and these kinds of things,
Oh.
HSAs are less and less appealing to many folks. Um,
Mm.
I could make a use case for them and against them, and both would I would think would be fairly convincing, but they would take a long time to get through. But in general, we just saw very low utilization with HSA, and you have to think about the consumer who's at even 400% of FPL, for example. That HSA plan does not have enough benefits to make the cost worthwhile for them, so they'd be better off getting a subsidy, taking, paying maybe $30 when they go to the PCP, versus out of pocket, even if they're only going 5 or 6 times and whatever they might be investing in the HSA, whatever the case might be, it's just not heavily utilized for the consumer that is the by and large the biggest proportion of the ACA. Might
Yeah, I would
I'm
change,
agree, Jared.
right?
I
Yeah.
mean, most anybody is forced into an HSA, not that they would want it. I think they'd rather have a more fully insured plan than one. I mean, it's really a cost play more than anything else.
And I think as ICRAs expand and gain popularity, I think maybe, we'll see that
For sure.
happen.
Definitely, I
I
think
think
it's
that's a really popular plan on the ICRA platform.
Yes, it definitely will become that. And then that's where we are waiting, frankly, on kind of that CMS adjustment, right? We all had to go to, the reduced plan offerings. I think that was a
Hmm.
really good thing with how I wouldn't like, at Oscar, we wouldn't like fewer options. But yeah, there
Hmm.
might be a point where we mature as a market. We understand, okay, Ohio, for example, as you mentioned, huge ICRA offering. Maybe we remove one of the other plans, add in a bronze HSA or a silver HSA. I could definitely see that being the scenario. But
Hmm.
I think it's going to be, at least from an Oscar perspective, a kind of state by state or case by case basis where we do see these ICRA groups coming in, and then we see this resurgent of HSAs being, for management or whatever the case might be.
Right. Right. Good. Jeff, anything else? I don't want to keep everybody. All of the brokers have lots of stuff to do, so I don't want to keep them on unless they want to ask a question in chat or in the question box. That's great. But I think we let Jared also get back to helping the product team, help develop the plans for 2025 as well. So, Jared, we always appreciate you being able to join us. And again, everybody, that is October 23rd on your calendar. And if you can't join because you're busy with Medicare, as always, it will be on demand on actually, it won't. That's not ours. That's yours, Jared. Sorry. Do they get
But we will
recorded, Jared? That would be a good thing.
all record it, and I'll provide a link that anyone needs. Just drop me an
Perfect.
email. You can ask
Perfect.
ask anyone. We'll have the link. Yeah.
Oh, perfect. That's great. That's great. Good deal. All right, Jeff, is it time to say goodbye?
It is time to say goodbye.
We could sing it. So anyway,
All right.
very good, everybody. Jared, thanks so much. Always appreciate you being on, and appreciate those of you who joined us and stayed on for, sometimes a lot is gained and learned in the sort of the chatter, the banter between us and the carriers who we get to talk to a decent amount. So good stuff. Have a great rest of your week. Appreciate you being on. What are you laughing at?
Goodbye, everybody.
Goodbye, everybody.
Thank
See you.
you.
Take care. Sure. Bye, Jared.